DxR Nursing Select, simulations to enhance learning and evaluate critical thinking. These interactive, professionally authored client case simulations allow students to work through a client problem following the key steps of the nursing process: assessment, diagnosis, care planning and intervention, and outcomes evaluation. Each nursing process step is highlighted in a separate section of the DxR Nursing Select case. This step-by-step approach allows for the flexibility of assigning an entire case or selected tasks, depending on the objective of the assignment. The student's job is to make key nursing judgments supported by pertinent data, identifying priority client problems, and developing a plan for helping the client achieve progress toward achieving the desired goals. Each DxR Nursing Select case includes a comprehensive electronic chart of client data. The cases include a virtual physical exam with a full complement of exam techniques and tools. Each case's nursing diagnosis section features nursing diagnoses selected especially for that case. Students address client problems by drawing from a list of potential nursing interventions. Finally, students analyze their client's progress data and answer questions about the client's progress. DxR Nursing Select records all student decisions. When the student completes each section, a score report is produced that is available for review by the instructor. The instructor's settings determine if and when the score report and expert feedback are available to the student. Now let's look at the sections in more depth. The DxR Nursing Select client encounter begins with assessment. The student first reviews the client's presenting situation in the chart assessment section. Students review their client's data, including admission data and vital signs, client history information, data collected from a review of systems, client lab results, and medical management orders. The student's task is to select the data most pertinent to the client's current situation and care. Each item selected is placed in the student's pertinent items list. Once they select everything they consider pertinent, the student clicks Task Complete. Some case sections include questions about the content or issues involved. The pertinent items list and the student's answers to the questions are automatically compared to the case author's criteria. A score report is produced. While the instructor has access to the student's score report upon completion, the settings set by the instructor determine if the student has immediate access to the score report. The scoring summary is displayed at the top of the report. In the detailed reports below, the student can see whether their selected data match the author's criteria, the items they picked that did not match criteria, and all of their selections. In addition, the student can see the pertinent items they omitted from their list. The Expert Feedback tab contains a summary of the key criteria for this section of the case. This feedback provides expert guidance to the student in reviewing the key nursing considerations involved in assessing this client. Each case section generates a score report. Student access to scoring data is determined by the instructor's settings. Now take a moment to review the key features of this section of DxR Nursing Select. The next section is a virtual physical assessment of the patient. The student reviews the client's presenting information and the summary of the key data from the client chart. Then they decide which exams they should conduct and identify the exam results most pertinent to caring for the client. Students may use exam techniques by choosing exam tools, procedures, maneuvers, observations, and tests. Exam results may come in the form of text, pictures, or sound, like these breath sounds. Some exams include questions requiring the student to draw conclusions about the results. As in the other sections, the student identifies the pertinent data in the physical exam. Their list is scored based on the case author's criteria. In the physical assessment, students are scored both on the exams they conducted and the exam results they marked as pertinent. Student access to scoring data and expert feedback can be enabled to guide the student's self-evaluation. Now take a moment to review the key features of this section of DxR Nursing Select. In the Nursing Diagnosis section, students use pertinent client data they should have gathered from the chart and physical assessment to select and support appropriate nursing diagnoses. The student chooses from a list of nursing diagnoses divided into nursing diagnosis domains or categories. Only those domains most pertinent to this client are displayed. This focuses the student on the most pressing issues. A search function helps the students find the diagnoses they want. The student compares the client data to the characteristics of the displayed nursing diagnoses, selecting diagnoses, and the patient data supporting those diagnoses. When the student completes their nursing diagnosis list, questions related to selecting nursing diagnoses appear. The score report for the diagnosis section rates the student's selection of both nursing diagnoses and pertinent supporting data. Now take a moment to review the key features of this section of DxR Nursing Select. In the Care Planning and Interventions section, students start with the priority nursing diagnoses designated by the case author, and then select nursing interventions that will assist the client in progressing toward the desired outcome for each diagnosis. As with a real client, some available interventions may be essential for good care, other interventions may be inappropriate or even harmful. The score report and expert feedback can provide students with corrective guidance, including warnings if students select inappropriate interventions or fail to select an essential intervention. The instructor may make the score report available immediately to help address errors in student reasoning right away when the student is most apt to learn from their errors. Or, in higher stakes assignments, the instructor may delay access to the score report and feedback. Now take a moment to review the key features of this section of DxR Nursing Select. In the Outcomes Evaluation section, students are provided a summary of the client history from the first 4 case sections, as well as new client data in the form of a nurse's progress summary, updated lab results, medical management orders, and flow sheets. Most cases have a nurse-client conversation as well.
Hi, how are you feeling, Connie?
Oh, better, I think. I'm not having those chills and sweats anymore.
Well, your skin feels cooler and your color looks better. Your temperature is down to 99.8 degrees.
The student must thoroughly review all the information in order to answer questions about whether the client is progressing and if any new needs have emerged. Evaluation section scores are based on whether the student can draw the right conclusions. Now take a moment to review the key features of this section of DxR Nursing Select. DxR Nursing Select allows instructors to see both overall and detailed scoring data for their students. To review scoring information for an individual student, instructors can click the detail link associated with the user's name and instantly see how the student is progressing through an assignment, including whether the student has started or completed an entire case or certain sections in that case. A score will be displayed for the sections of the case the student has completed. By clicking a link within the instructor tools, the instructor also has access to the detailed score report the student sees at the end of each case section. This allows the instructor to see the specific items the student selected or omitted from their workup of the client. Instructors also have access to data on group performance. The instructor can sort the results by case, section, and task. Group performance data can be printed to provide a visual display of students' performance. DxR Nursing Select cases are accessible by any compatible computer or tablet with a compatible browser and a stable internet connection. DxR Nursing Select is designed to allow instructors to right-size their assignments based on their educational goals and their students' needs. With 15 virtual client cases to choose from, instructors can assign cases that reinforce key concepts or subject matter they're teaching in the classroom. Easy-to-use faculty controls allow instructors to set up a case or a group of cases, install the sections of the case they want their students to complete, and to set the time frame the assignment will be open to the students. DxR Nursing Select is flexible enough to allow instructors to assign an entire case or only certain sections. Also, instructors can assign DxR Nursing Select cases or sections to students as make-up for missed clinical assignments, as extra practice without faculty oversight, or as a study aid. DxR Nursing Select also can be integrated with compatible learning management software. This feature allows instructors and students to sign in through a compatible LMS and link seamlessly to DxR Nursing Select without requiring a separate login. An intuitive interface, automatic scoring and expert feedback, flexible assignment options, and rich score reporting make DxR Nursing Select a good fit for the demands of undergraduate nursing education. DxR Nursing Select, simulations to enhance learning and evaluate critical thinking. For more information and pricing, contact DxR Sales.